HR, His Royal Majesty. Oh my goodness, I love the name of this TV. HRE TV. Oh my goodness. Just catch us live on YouTube. Just go there, HRE TV, and click subscribe, and then get updates on everything that they put there, and then watch them also live on Facebook. When you hear the name HRTV, you are talking about television that comes from the heart. Oh, HRTV. Oh, Makuma Tomi Mwati. Me that one say. Good morning, children. A B C D E F G H R E H R E HRE TV. Go and watch HRE TV. Bye bye. HRE his right.
Yankutuna nasio nyameno no. Yanana se wa maya tamfo atishoko.
I was at one, your friend Calibos, the only boss with what is. Do you know about TapTapSend? Unima Metro. TapTapSend is one of the easiest, convenient, reliable money transfer app you can get. You can download TapTapSend on Google Play Store or App Store. We download it and then you register. Register and you are good to go to send money across every place, many countries in the world. TapTapSend. Why wouldn't that? I was at one, your friend Calibos, the only boss with what is. Do you know about TapTap?
Ebusia Fema Mujina Akwaba Eba HRE TV so Sabre Jumedia Yatuni Ding time with TapTapSend so and I'm over Sabre I think say you double feed Beba. Okay, I think so. Facebook no ETC mo. Mo fan sharing. Sabre Jumedia ya babedi edian ya to ne den time with TapTapSend Joada enyume bia no sia pepepe ye de bramo sande de hyehyɛ so kama no. Now in the last day of breast cancer awareness na sana ye share mobo ne ka say ye de bebramo no na che say ne sa pepepe ene ye de ebramo Sabre into no breast cancer awareness and ye be di ho dwuma na a couple weeks ago yeah discussed this topic don it was more in depth of what we need to know and what causes it and also how to treat it as well and the precautions are also and that's the preventive measures are we have to look into it when it comes to being having some interventions and measures that will control it. The good thing is in there, you may just Q&A session. So it's going to be more of like questions. Number a couple weeks ago, I remember no. Now the questions are to draw in there, and also so my bomb pink. Kama. Real man wears pink. Aye, into no. You better fast when you see mo bibia kwaba. Bibia will be a honcha kese pa any edema no. So Europe, so Asia, so Africa, and also USA and Canada, Brochimemu. Honcha kese pa ene de ma ne ka se de wase se wadaje na wo tie yen wase wadaje na wo hwen yen koso ne hwe HITV Jumedia yeto ne din time with Tatapsen. Na ipanyefo so koto sa aboa bi si apampa so a na enya ne pe na obi ne kukuru no edi ne si o. The same thing no ipanyefo bi na so ya sene ana kukuru yin abebesu pempe so yi so na ye di dwumade ebra wo titru no di kan any feel good services or say brand all your motivational speaking and I say speeches and mental health education eba adwene mo apomodeni nimde dia o madokoro ewo mo pa yi enti no feel good service na become for man obusuafo enyina saa so biom no se udro Ghana na so pa bia pa ada na wadwodwo ho ana pedan po ato ana se bia asase po na pa ato ana se bia opiso customize wa sa building na say ye condos apartment ana say full house crapa po metra kwan Omu US number near 513-372-5758. And I say from Ghana number no 233-208-149-504. And our email address now feelgoodservices@gmail.com. Now for the Christmas Eve ye busu for Ghana. Say nyo mpo da kwa we busu ni bia na wadam for the kwa po da kwa. Don't me bookie Airbnb ni bi na ko in temper. And twema December but now the price na enko double. Yes, I was so be she pay PE. Ebiom Happy Glow GH. Osiwa ba wenya bibi papa adwojo ho na feel good am bibi papa adwojo ho no na wo sa so ede ohunam dua wapɛ ho akode a ebema onipadua na se owedie no atoso kama we natural beauty pronouncement enye nia epo eni bi no sa so no mo se wo nan ho atwintwam te se media yi na se wokoda obenya ne na moja April wompa eso a na te se enye obi ana so nkrosu obi ana se bi ntonto bi na bebe ba wagasa na ho ne etwitwi bo ho se sandpaper no enti kodekoye wo pedicure no manicure kira kwan e wo Happy Glow GH omo Ashaman Estate 20 meters away from the community hospital right opposite Veggies and Grow from omo 233 and plus 233 594710391 na ko okwa kachen se pikin na smile na make sure so beje wo discount so account sa so biom na America wo se wo pe suit papa ebeda wo ho na afedie abrantie wo so wagina wo na so na afedie mema kasa wo so weti wo bo akebi oba so ema Asia eyi acha wo so wetimi eyi acha ni bia na me kanfo Blandis Bespoke Blandis Bespoke say bra na afedie moma wo suit papa omo yes suit for all events and occasions with the exception of divorce party. Apart from that, in the year cramp no on be was kama pa ama bibia akoso kama. Ebiom ne di ho tap send se men kanchira wo se ope kwan ya be fast was sika akogana fast, secured, reliable, no issues. And na good news is will be from tap send akachi bia no on for my na for the yesu yen to jumede so. Medamase. Dr. David amakwa ba ebe jumede so.
Okay, good evening.
Good evening.
Okay, good evening, Patrick. I say thanks so much for everybody that was able to make it today. Jules, I see you. I see you moving. Good evening. I know. Now you're on mute. Jules, you're on mute. But thanks everybody for coming. PK, again, thanks as usual. If you could have somebody check your sound, I think you were echoing earlier. Maybe it was just on my end.
Yeah, it was on mine too.
Okay, so I'm sure.
Is this still echoing?
Yes.
Sir.
Yeah. So yeah. But yes, good evening, ladies and gentlemen. Again, same time every week. Thanks so much for coming. Making time for us. Any update from TapTapSend? And I think, as everybody knows, we're still driving the Bronya Chedia, which is mostly focused on Christmas giveaways. We start on Christmas from October 1st to December 28th. What it means is every week, anybody that sends more than $300, well, in the States, $300 or $300 Canadian dollars, has a chance of winning a $50 Amazon gift card every week to the end of December, to December 28th. And in the final draw, you get a chance to win a plane ticket, an air fryer, and several prizes that we have for the grand draw in December. Air fryers, blenders, flat screen TV. So it should be fun. But yes, not to spend too much in the time today. I know it's already almost 6:20. So I'll give right back to you, PK, because I know it's still Breast Cancer Month, and Julie's here with us, so we're happy to have her back. All right, back to you, PK.
Okay, Director, yeah, that's it. Sabre, was we still working on the echo? No, is it still bad? Director, echo near bad still.
I'm trying.
Maybe
let's take a commercial break and reset some stuff. Perhaps.
Maybe a pre-sec for Winnie and Intia.
Here we go.
Except for winning national science and math quiz, now my echo.
I was at one, your friend Calibos, the only boss with what is. Do you know about TapTapSend? Unima Metro. TapTapSend is one of the easiest, convenient, reliable money transfer app you can get. You can download TapTapSend on Google Play Store or App Store. We download it and then you register. Register and you are good to go to send money across every place, many countries in the world. TapTapSend. I wouldn't that. I was at one, your friend Calibos, the only boss with what is. Do you know about TapTapSend? Unima Metro. TapTap.
All right, Bushia first. Is it director? Yes, it's a. Obiabi
No,
to be. It's still echoing. Oh wow.
Yeah.
Anyways, you better so na did you no now was our producer taking care of whatever the situation is because we are very confused the entire echo, but we'll fix it as usual. Miss Jules, yama kwaba eba HITV subiom as usual with time with TapTapSend and Dr. Stephen Boateng also yama akwaba kesiepa eba HITV. So in the last day to talk about breast cancer awareness. A pahua will be the kind of say pahua this afe. Nti eka ho asem yenka ho asem bioma go see next year. But I know that there'll be so many programs going on concerning breast cancer awareness. Nti no doc any Ms. Jules yebeja platform na mama na afedie mama ye ehu ne ekoso. I hope some weekend was great.
Weekend was good. I had a bad day today, but I'll recover.
Oh, sorry to hear that.
I'm sure you know why, but I'll be okay.
Oh, okay, Dr. David. Oh,
I try.
do you know?
I heard your comment earlier, so no comment. We can move on.
Oh, about what specifically, Dr. Stephen? So I didn't hear.
No, he's talking about his echo is because of the school that just stole the National Science and Math quiz. So
Yeah. I mean, we don't count it as a win. It's expected. It's not a win. So I mean, it's okay.
Me too on my side.
We all move on. You know, it's okay. Look, I know how you feel, Dr. Boateng. It hurts. You know, it's okay. We just, it's fine. You didn't expect anything else. Like, let's be sincere.
How do you say he's not expecting anything less?
Now and then, but we'll
That's
move
what
on.
losers typically say. When they lose.
Look at Miss Jules is laughing.
A win's a win.
But no, thank
no,
you.
Dr. Boateng, did you hear what he said? He said you don't expect anything less. So he knew Presec was going to win?
No.
I'm sorry, you echo. We can't hear that up here when we win. We can't hear when people echo down there. We can't hear them. So up here, I mean,
Okay.
Dr. Boateng can hear me. Right? I can't. It's too much echo when people don't win. So I'm sorry. Let's get the show going. This is only for winners. Doctor, please go ahead.
Thank you. No, thank you, everyone. I'll recover. I'll be okay. I'm still a proud of Warren, proud of Katachi. But thank you, everybody, for joining our conversation today. Just like PK said, right? We kind of spent the first session, which is a couple of weeks ago, really diving into breast cancer. We got a lot of great insights. I learned a ton from Miss Jules and, your experience and everything to do with Pink for Africa. But I think today, this conversation is for all of us. Today is an open conversation where, please, any question that you have or that you're thinking about, whether it's from the last session or even from today, please feel free to put that in the chat or raise your hands, or feel free to just, unmute your mic and ask those questions. But we have a couple of questions that typically have come in that we're going to start this conversation with. So I'm going to share my screen. And before I do that, Ms. Juice, I want to turn over to you to see if you have anything to share or talk about before we kick off the conversation.
I'm just really excited that, we had the opportunity to come back. I want to say thank you to the station, to PK, to TapTapSend. Listen, you guys rock. Thank you so much for shedding light on this amazing and wonderful need that we all need to learn.
Wow.
Miss Jules, sorry, not to interrupt. We owe you. I never got a link to do the donation. So let's make sure I get the link today. Please.
I will send it. I don't know if I have your number, but I will send it.
If you can send it to me, that'd be great. We don't have the link yet. So just for the record.
I got you.
Miss Jules.
Thank you so much.
Miss Jules, send it to me and I'll send it to him.
Thank you, Miss Jules.
I'm on mute.
Again, just like we said, right, today's session is just strictly focused on highlighting some key, questions that will typically come up about breast cancer. Please, if you have any questions, anything you're thinking about, anything just piquing your interest, right? I always say we learn best when we learn together. So please feel free to share that. So the way that we are going to have our conversation today is think about, a typical patient journey for someone who lives or is battling breast cancer, right? I think that the one thing that with breast cancer that for me is so humbling is that there's so many different steps from a patient being diagnosed all the way up to treatment. And even post-treatment, what does that look like, right? So we're going to go through each of these 4 steps we have here and just kind of pull out some of the key questions that typically come up for patients or for family members or for friends or just for fellow advocates that come up around these journey lines for a patient. So that's what we're going to cover today. So I just want to dive in, Ms. Jules, and start with, when you think about a patient who has been diagnosed with breast cancer, right? The first step always is just making sure that there's that screening and biopsy. That is when we typically find out what's going on and if this is someone who truly has breast cancer or not. And so the big question that I wanted to start, and Ms. Jules, I want to ask you first is, for anybody that is curious about breast cancer in general, at what age should people get tested? To know and understand their risk for breast cancer? What would be your advice for people?
I think that last week we touched on this. I think that based on family genetics, based on dynamics of the kind of family you're from, and if people in your family has been diagnosed prior, the best time to diagnose, let's say, for example, I was diagnosed at 40. So all my nieces, everybody in my family, my nephews, everybody in my family needs to be diagnosed 10 years prior to me. Oh, I'm sorry, I said diagnosed, needs to be tested 10 years prior than me. And I think that the first step is really with self-examination and making sure that your doctor knows the history of your family. That way they can really hone in on making sure that all the dots are dotted. Every I is dotted. I'm fumbling today.
No.
Every I is dotted and everything is checked because, the early stages of it, we've all heard it over and over. There is no pain. There is no very minimum signs sometimes. There are some lumps that are not even detected that are cancerous. So having that history come forward is so important.
Yeah, no, thank you for sharing that. I think for me, I get this question quite often too, right? People are like, hey, am I too young to just go understand my risk factors? And you brought up a good point, right? A lot of the time, the family history plays a big factor. Sometimes the fact that maybe there might be family history related to breast cancer, that might be good enough just for you to go and understand what your risks are, which would include those testing, right? Yes, testing is not accessible and available to everybody. And that is a big part of what we're trying to talk about today. And I know that's a big part of what you all are doing, Pink for Africa. But I think for any of us that have the means and capacity and capability to be able to know, at least understand if your family history is there, that will put you at any risk. You want to at least find out, right? There's other risk factors, which I'm going to talk about. But I think what I wanted to really allude with this conversation is, look, guidelines will say 40 and above, right? You have guidelines that will have varying numbers, and some say 40, some say 45. But I think overall, even regardless of that, if you feel like you said self-examination, something isn't wrong, you don't have to wait.
Absolutely.
Right? Or if you know a family member that says, hey, I think something's not right, you don't have to wait, and you can at least go and understand what those risk factors are. So thank you for sharing that.
So Doc, can I piggyback off that just a little bit for you? This October, as a matter of fact, a week ago, we donated to Kolebu to 10 women. 3 of the 10 women were under 25. So it goes to show you that even though, yes, 40 and above, we're seeing these tumors show up in younger and younger women. So it is very important for that self-examination to be at the forefront. When you go to your doctor once a year, make sure that your doctor does check your breast, regardless. You don't necessarily have to do the screenings of, going to have a mammogram, but the doctors can usually pick something. So if God forbid there's anything existing, they can catch it a little bit on time and then follow suit with your mammogram, your ultrasound, your biopsies, and all of that.
Yeah. Thank you for sharing that. 3 out of 10 women. Just think about that. And you talked a lot about it last time when you were talking about even triple negative breast cancer.
Yep.
Thank you. Thank you for giving that insights too. Appreciate that. Okay, so the second thing I wanted to talk about, again, we've been digging a little bit more into the risk factors, right? So again, we're walking through a journey today. That's step 1, is understand the risk factors and start to think about diagnosis. I think it's also important that we have a conversation about what the other risk factors are, right? So most of the time, question we hear is, hey, what are the risk factors for breast cancer in general? And we just talked about the family history being a big part. The one thing I just want to make sure everybody knows is there are some of these risk factors that we can control for, and there are some that we just cannot control for, right? I don't think, and I know breast cancer, of course, majority is women. It can occur in men too, although it's rare. I always want to make that point out. But, for women with breast cancer, women didn't choose to be born to be women, right? And so there are some that are controlled that we can control, and there's some that we cannot control. So I just want to highlight some of these, and I'm going to use my laser point if I can find it.
Doc, can you hear me?
I can find it. But the first thing I just want to point out is when we think about all of these
Doc, can you hear me?
factors, the key point is making sure about it is that the ones that we can control, whether it's decreasing alcohol intake, whether it's making sure overall the totality of healthy lifestyle is being met. All of these things are very important. These are things that we can control for in certain cases, and I think we should pay attention to that as well. Genetics is very huge, especially in precision oncology right now. There's a lot of different therapies that are looking at specific targets, right? And so there's a lot of advancements in science right now looking at what genes might be driving specific breast cancers, and that can actually impact treatment. So these risk factors are very important, and that's why I think it's important that at least we know about it. And again, if the fact that a woman might have a dense breast mass tissue compared to maybe low dense breast mass tissue, that might be a risk factor, but that doesn't always mean that, okay, only women with high breast dense mass are the ones that might have breast cancer. These are just guidance. I think it's important that we all know and are aware of that when it comes to finding out and understanding what the risk of breast cancer might be for all of us. So thank you again. Anything you want to add here, Ms. Juice, when you think about these risk factors?
No, I think that you pretty much touched on it. I think that the importance of exercising and overall, health is so important. Allowing your body to sweat, allowing your body, I tell people, some people will ask me, does deodorant give you breast cancer? I'm like, no, but your natural body should sweat. So if you're using antiperspirant, you're stopping a natural process. And that being so close to your armpits, you want to be sure that your body's releasing all the toxins out of its body. So you want to be mindful, and instead of using antiperspirant, do deodorant. There's no proof of it, but just the unnatural nature. And as you talk about alcohol and everything else, I think you are so on point, Doc. This is really great.
Thank you. Thank you again. And I just put in the chat as well, please, for everyone, as we go through this conversation, if anything comes into mind as Ms. Jules or myself, we're sharing all of these key lessons, please ask your question. This is why we're here, right? Closing out breast cancer awareness.
Doc, can you hear me now?
Strong note. PK, go ahead. Can you hear us?
Okay, am I still echoing? Or is it better now?
Yeah.
You still get an echo feedback?
You still are.
Okay, so I wanted to just ask you, I mean, if you guys can hear me a little bit, I just wanted to make sure that people can still ask the questions whenever they're ready. I know you are ready for them, so please, viewers, and also those of you on Zoom, if you have any questions, please ask them. And I know Doc will just take a break and answer the questions and just proceed as it goes. So please ask your questions if you do have them. Thank you.
Thank you. Thank you, PK. All right. So the next thing that we want to talk about, again, think about that journey we're talking about, right? Step one is always trying to figure out screening, which includes that risk factor. And that's where people are typically getting a biopsy. Now, step two is when diagnosis actually happens, right? So if a woman might be contemplating, hey, do I or do I not have breast cancer? Some of these risk factors we talked about might be pertinent to them. They might go see their doctor. They might get this biopsy done. And then through that biopsy is where that diagnosis will come to. So from that stage of, thinking about diagnosis, the question that, comes up a lot is, for a person diagnosed with breast cancer, are cancer cells in any part of the body aside the breast? Biggest question usually we hear is, okay, a woman might be diagnosed with breast cancer, say on the left breast. Does that mean that the breast cancer is all going to move to the right side of the breast? Or does that mean there's now cancer throughout the whole body, right? And so for me, the one thing that I just want all of us to understand is that there's different stages of diagnosis, right? So when, and again, that's why we always talk about early detection is important. So early detection sometimes might be the perfect reason why this cancer could be catch so early that it doesn't have to move around through the body. And when it moves around, scientifically, it's called metastasis, right? That is where you see the breast cancer moving around the body. So someone could have breast cancer and they could be talking to you about their lung disease because their disease has metastasized from their breast over to their lung. Someone could talk about their bone metastases. Someone could talk about their brain. So these are actually around four of the main common sites where you tend to see women that have breast cancer. The most common sites where metastases happens is typically these common sites that I just mentioned. But I just want all of us to understand that early detection, it's very, very key. So if you're ever wondering, if I get diagnosed with breast cancer, say on my left breast, does that mean I have cancer throughout my body? Not necessarily. It could just be localized, right? It could just be that place. So typically stage 1, stage 2, stage 3, most of the time it's called local disease. Now, if a woman has stage 4 breast cancer, that is when we know it's moved from one site to different sites. Unfortunately, for some women, when they get diagnosed, they're actually in stage 4 or in the metastatic setting, which is very, very hard to treat. And we tend to see a lot more complications too. So again, when you think about breast cancer, just remember early detection is key. And that's why we always want to make sure we keep having these conversations to bring more awareness. So Ms. Jews, I just want to turn it over to you. When you think about that diagnosis stage, right? Think about your journey for yourself. What are some of the things that you like to share, or what are your thoughts in terms of thinking about how early detection is so critically important?
I mean, I don't think we can emphasize enough. It is pretty much saving your life. But I know that, an early detection, an early diagnosis here in the US versus Ghana can be two different things. When you look at across Africa, we talk about the steps and everything else. It doesn't always apply the same way across Africa. So I think as much as this is, going to serve as big of a population here in the US, we need to understand that across Africa, early detection is all we got. We need to make sure of that because cancer is a very expensive disease and majority of us cannot afford it when it has gone too far. So we cannot drum it enough in everybody. Please, once a month, 1 week after your periods, check your breast. If you don't get your period, check it once a month, pick a week out of the month and do it. The men, please do it once every 3 months. But it's very, very important to learn those steps and do those self-examinations. When you feel something is out of the norm, let a doctor look at it. Through proper testing, the doctor will then diagnose you from that point on. Please don't feel a lump and start screaming, mewo, mewo. I beg you, don't do that. You're only, creating fear in yourself that does not warrant it. So please make sure that That feeling a lump doesn't necessarily mean you have breast cancer. It means you need for a doctor to check and go through the proper testing.
I love that. And thank you for sharing that. I was trying to take some notes as you were talking. And one thing that just stood out to me, just like you said, right? We get in the trenches, right? We think about breast cancer, a lot of these oncology treatments, and it's mostly applicable to here in the US and, of course, a lot of Europe and stuff like that. But you made a point, you said early detection in the US could be vastly different if you think about the same thing in Ghana. It's literally like night and day. And, you know, one thing you said I really liked is you said early detection sometimes could be all we got. And again, that's why this is important. And I couldn't agree with you more. I think for some women, that's all they got, literally. And what that means is maybe they might have to have breast surgery, right, mastectomy, and have that taken out. And maybe that could be life-saving enough for them too. So early detection is critical. Our hope is get to a point where we have equitable care and access. That's why we have these conversations, so we can bring more treatment options for our mothers, our sisters, our wives, and our family members back home. But at least for now, what we have, we need to at least take advantage of it, and that is early detection. So thank you again for sharing that. And I'm going to keep looking through the chat too as we keep having the comments. I haven't seen any questions coming yet. So I want to move on to stage 3, right, of the patient journey. Do you have anything? Go ahead, Ms. Jules.
Yes, Doc. I just wanted to add a little something. So about 10 years ago, we ran into a woman in Kumasi called Mampokwa. Mampokwa at the time was about maybe 78 years old. And when she turned 39, there was a visiting doctor who came to Kumasi and gave her a breast examination and suspected there was something going on. They went ahead and did testing and realized, no, she's cancerous. They immediately took the breast off. She didn't get any chemo, didn't get any radiation, didn't take any medication. Mampokwa lived till she died at 87.
Wow.
So when we say early detection is key, it is key in the world we come from and why we are advocating so hard. You know, more of our white women are diagnosed with breast cancer, more Black women die. And this is across the world. It goes to show how, as women, we do for a lot of everybody and sometimes don't put the focus on ourselves. So please, my dear sisters, aunties, mothers, do not play with this. Self-examination early detection could help save your life, please.
Well, before I say what I was about to say, Jules, I got a question for you. Did Mampokwa died because of breast cancer, or she died natural death? Or a different cause?
No, she died a natural death. She died of old age.
Wow. This is beautiful.
And, you know, she shared her story very vividly about how the neighborhood people used to tell us she was a witch because she didn't have one breast. They you know, the stigmas were horrible. But she stood tall and she said, listen, I'm alive today. I don't care if I don't have breasts. I'm alive. She ended up inheriting over 20 grandchildren and lived a full life, because her breast was removed at the age of 38. So I think it is so important that we share these stories and let people know these stories and hear these stories, because, you know, we are not only defined by the outwardly, you know, person. My husband would have given up a whole lot if he said, listen, your one breast is gone. I don't want you anymore. I'm still here 15 years in. And still thriving. So I think it's so important that we share our stories and we tell each other and truly let each other know that there is life beyond breast cancer.
Okay.
If you are caught early, yes.
That's beautiful. I think that's a very good testimony for us to hear in terms of how breast cancer can be very, very, intruding. At this point, please, you can unmute your mic and ask your questions so that we can proceed with the risk factors and also the journey through breast cancer. Please unmute your mic and just state where you're talking from and also what your question is about.
Thank you, PK. as we keep going through this journey, right? The next thing I want to talk about, so, let's, God forbid, let's say, a patient is diagnosed with breast cancer. They went through their screenings. Well, before they got diagnosed, they went through their screenings. Now they get diagnosed, go through biopsy. Biopsy detects whatever type of breast cancer they have. And I'm not going to go through all of it because there's so many different types, right? They get diagnosed with breast cancer. One of the biggest questions that comes up is, should I have surgery or not? And Ms. Jules, you kind of alluded to it. For some women, and especially some of these under-resourced communities, that's all they got. It's just mastectomy. It could be bilateral or just one, right? So again, the question here is, for a person diagnosed with breast cancer, if I decide to go for a mastectomy, what are the risks and what questions should I ask before that mastectomy and also after? So what are some of the advice that you might give to someone that might be thinking about the concept of mastectomy in general, and what type of questions should be asked?
I personally feel that it is very important to know the position of where the tumor is and whether a lumpectomy is an option or a mastectomy is an option. The type of cancer is key because there are some cancers that, like you said, Doc, there are so many different types. Some grow rapidly, some, the spread of it is too wide. So when they go in to do a lumpectomy, it will deform the breast. And then age factor. If you're younger, your hormones are raging, is based on the type of cancer. Is it worth the doctor having to keep a very close eye on you? God forbid it comes back, things like that. I just think that is very important for women. I don't think I've ever met any woman who said, I regretted doing my mastectomy. But Lord knows I've met women who said, I regretted not removing the breast because my cancer did come back. Not that it comes back for everybody, but for those who it comes back for, I feel there is too much importance placed on breast because we sexualize it, right? So there is a validation that gives a woman. And I remember I started writing a book, and as I'm writing this story about my own journey and my relationship with my breast, for the first time, you start to have breasts as a young girl. It's validation to womanhood. And then you go into the first time a boy touches them. Wow. Then the first time you get to breastfeed with them. Wow. So there is all these relationships you build throughout your life as a woman with these breasts. And then a man is excited when he's with you and you have beautiful breasts. So whether we like it or not, there's an attachment to it. I pray that women, as we have these attachments, we also know that they can kill us. I've seen signs that says my tatas almost killed me. And it's true. So, listen to your doctor's advice, learn more about the disease and what type of cancer you have and what the reoccurring factors are. And I'm sure, Doc, you can explain so much more into that before you make that decision. But that's a decision only you can make. In America, your doctors give you that opportunity, especially if you have an option. I had an option to do a lumpectomy or to do a mastectomy. And on the second review, when I went to see the doctor for a second opinion, she happened to be a woman, and she said, listen, you're young, your hormones are raging, the type of cancer you have may come back. Do not open yourself up for that. So I listened, and I'm grateful I did.
That is a good point. There's a lot to unpack over there, just like you said. I think that, of course, the aesthetic component when we think about mastectomies is probably the biggest conversation. But what you said was that, you've had women that would come to you and say, hey, I wish I took the breast out because my disease came back, right? But you never see it in the reverse order, which I think is so important. So let's dive into it a little bit, just for the sake of all of us learning. So like you talked about, the way I like to summarize, when you think about a lumpectomy, right? So now you go through screening to identify where this tumor is located. Is it possible that we could just go in there, or the providers can go in there and just take out that specific lump, right? And save everything else. It's a lot of questions that have to be asked around that. To your point, a lot of breast cancer is hormonal driven, right? You hear a lot about hormone receptor positive breast
Yep.
cancer. So a lot of the time it's just that and again, it's not about these hormones being abnormal, right? These are normal hormones, estrogen, progesterone, right? These two key hormones are the ones that typically are driving a lot of different systems in a woman's body. It's the same hormones that these cancers love. And so these cancers literally feed off of these same hormones. So to your point, if it's a younger woman that might have a higher risk with all of these hormones, these are some of the questions that you might want to ask. If I do a lumpectomy, is it possible that my hormones could drive this to come back again? Now, that might be a reason why you might have to have a conversation to go with mastectomy instead. Now, if that's an option available, right? So I think there's a lot of questions in there you've given us that I think for any woman, or even if you have friends, or even you have family members that are thinking about, hey, if this were to happen to me, what are some of the questions that I want to ask? The goal of this conversation is, Ms. Juice, you've given us a lot of tools to put in our toolboxes. One thing that I always say is, it's like death, and this is gonna sound novel, but I'm gonna say it. We don't like talking about death in our community, right? But it does happen, and so it's like, if you live here in America, a lot of people will come through and have life insurance conversations, which is tough to have because you're pretty much assuming the worst, right? And again, I don't want everybody to associate the same thing with breast cancer, but we don't like to talk about cancer. But it's important that we learn about it, that we know and have these tools in our toolbox. Or sometimes even maybe, unfortunately, the doctor you might see or the clinic you might go, they might not even have the tools and resources
Right.
to help you. And you might have to be your own advocate and asking some of these questions too, which is why I think it's so, so critical that even, something that someone says, oh, so simple as, well, just take off your breast and you'll be just fine. There's a lot more to it that people might also note. And I never thought about this too, like you said it. Women build relationships with their breast throughout
Yeah.
their life journey, right? From childhood all the way until adulthood too. So now you walk up to a woman and say, hey, guess what? We got to take these breast tissues out too. So women have the right to understand what this is like, but also have the right to also know and ask the right questions too. So thank you. Thank you so much. I'm
Yes.
taking a lot of notes. So thank you for sharing.
And Doc, one little thing I wanted to add for us in Africa, the mastectomy versus a lumpectomy becomes, especially in early detection, becomes cost effective too. Because if a mastectomy is done at an early stage, let's say stage 2, and the position of the tumor requires a mastectomy, sometimes the patient may not even need radiation. But if they do a lumpectomy, they end up needing radiation. And for financial reasons, our economy and our world does not allow us to be able to have that luxury. So that decision, that advice where somebody living outside of Africa could benefit from having the luxury to be able to choose a lumpectomy over a mastectomy, I think across Africa, we just need to be very clear and very fair to the patients as to economic, factors, and be able to advise properly on those decisions.
That is very important. Thinking here in the US, like a lot of the time, radiation is like, okay, hey, right after your surgery, we'll just do radiation and just knock out anything else that's left, right? So that's typically what radiation goes to. And sometimes it's not even a big question because most of the time insurance will cover it and they understand why it's needed. But think about, our communities. These are luxury items for people to have, and these are expensive. So I couldn't agree with you more. So thank you for sharing.
Doc,
you're welcome.
Go ahead, PK.
Would you want to address a QS question?
Let's see. Yeah, so Akira is asking about HPV, right? This is human papillomavirus, right? Now, not necessarily tied to breast cancer, but I think it's important. So HPV increases risk of having cervical cancer, right?
Right.
So that is why I think Akira said, I know this might not be related, but can you please share your knowledge on how HPV can cause cancer and what you would recommend if a lady tests positive for HPV? So first things first, I want to point out there's actually vaccines that you can take as preventative, right? And these are typically recommended for all women. And again, age factors might vary, but I think it's important. First of all, if you have had positive results from HPV, I think it's important. Sometimes they can put you on some medications. It's not going to take it away, but it can help suppress it. And there's different papillomaviruses around the body too. But the biggest one that I think Akua is referring to is the one that increases women's risk of having cervical cancer. And again, actually knowing and getting tested to know you have HPV, it's one of those preventative approaches too. So now your doctors can be very aggressive in educating you and providing treatment. So at least they don't have to catch a cervical cancer when it's in the metastatic setting, if you do get it. So I hope this helps answer your question, but I think there's a ton of value if someone has tested positive, having those conversations with your doctors to understand what are the risks of having cervical cancer now? What are the treatment options if that were to happen? And are there any other additional preventative things they can do? And also have conversations with their partners too. That is very, very important. So thank you for that question. Yeah, we can always learn not just breast cancer, but also cervical cancer. So thank you for that. The next thing I want to talk about is just walking through and finishing up this journey, right? Like we said, these patients are going through a lot of these different steps. The next and obvious choice after a patient, whether they decide to go through surgery or not. And I think Ms. Jules, you alluded to it. After surgery, sometimes technically radiation is considered a treatment too, right? They could get that treatment too. And aside that, the next go-to is typically medications, which the most common term that we hear is called chemotherapy. So the question we have here is, what are the most common side effects of the chemotherapies that may be used to treat breast cancer? I could nerd out here and go on, but Ms. Jules, I want to ask you first, right? And I want to kind of just have you reflect and look back when you went through your journey 15 years ago. What were those treatment conversations like, and how did that help you make a decision in terms of what treatment approach you would want to go? And I can dive into the side effects after that.
It's so interesting, Doc, because breast cancer affects a woman in so many different ways. We talked about the removal of the breast, the deformity of the breast, if a lumpectomy is done versus a mastectomy, or the removal of the breast. Now we're diving into chemo, which is a really, really, a very important part in the healing process. But as a woman, you also get to lose your hair. And you lose your hair in every form. So all over your body, you lose your hair. You're not the prettiest, you're not the most beautiful woman anymore, because again, outwardly, we only see the outside. Now, when I was diagnosed, I had hair all the way down to my back. And I remember my doctor telling me almost 15 years ago, the type of chemo we're going to be giving you, you will lose your hair. Now, 15 years fast forward to today, chemo is very different now. And women are going through chemo, and some of them, majority of them, don't even lose their hair anymore. So I think it's really interesting how just over the years, the different medications come up, and through our great researchers and all these people out there looking for cures and looking for better medications for us, and realizing how psychologically it impacts a woman. So after you've lost your breast, you're put through this rigorous chemo process. I remember having sores in my mouth. I remember my nails were all black. I remember losing every single hair on my body from my head to my toe. And I remember feeling like I'd gotten the flu times 50. So it's really interesting. And again, everybody responds to it differently based on the type of cocktail, I remember they called it, based on the type of cocktail you got. But the cocktail meaning the different types of medication that is put together and given to you. One thing that I remember hearing remind myself during that process is, this too shall pass. No condition is permanent. And knowing that no matter what I went through, there was a light at the end of the tunnel. So, I will say to everybody, I had the privilege, and I say privilege because I remember one of the days I finished chemo. I was waiting to go in to get chemo. And there was a young girl, she must have been in her early 30s next to me. And she said to me, hi, how are you? And I responded and I said, she said, is this your first time? And I said, no, this is my third chemo. And she said, oh, wow, this is my 29th chemo. And my doctor just told me it did not work. So here I was at 40, going through this journey, having caught my breast cancer at a very early stage, having gone through a mastectomy, going through chemo, and meeting a 32-year-old girl who had been through 28 cycles and telling me her chemo did not work.
Wow.
So every day you are grateful for whatever situation you are in, and you're thankful. And I think that we need to learn that no matter what life throws at you, it's always how you get through it. I prayed for this young girl I didn't know until I don't know if she made it or not. But I continue to pray for her because I realized how lucky I was to have gotten only 6 cycles of chemo as a preventative process. She was getting it for complete cure. So, Doc, over to you.
Okay, before Doc takes over, Doc, can we go ahead and look at Sir Wayne's question? I'll let you read that.
Yeah, let me read. It says, how true is it that massaging breast regularly reduces the risk of breast cancer? This is important. So the truth behind massaging breasts is it's not going to reduce the risk of breast cancer necessarily, but it can help detect, right? Now, here's 2 things I always like to remind people. Of course, not just the breast. Think about massaging in general. Massaging is helping drain the lymphatic system too, right? So a big part, I'm going to nerd out here. When you think about, where the breasts are located, think about our lymphatic system. A lot of the time, actually, the first place that you might see metastases happen with a lot of breast cancer or even a lot of different cancers, they go to the axillary node, which is usually right underneath the armpit, and they go through other lymphatic systems too. I see Juice nodding head. This is where I didn't want to nerd out. But I think it's important to understand that massaging has a ton of benefits, right? As far as just lymphatic drainage is actually good enough. But the most important reason why that can be recommended is because of the detection factor. It's not necessarily going to help, reduce the risk, but at least can help detect it too. Now, if a woman has breast cancer and they're taking chemotherapy and they ask me this same question, I'm going to tell them to be cautious. There are some chemos that can cause something called extravasation. What that means is that chemo can spread around very quickly. And sometimes what that means too is its side effects can be more severe. So doing that extra massages can actually make things a little bit worse if a woman is taking based on the specific chemotherapy too. So, Sarah, and I think that's a great point. I just want people to understand, depending on who you are, where you are, do you have breast cancer? If you don't have breast cancer and massaging is something that you want to do or you want your partner to do, I think that's excellent because that can help with detection. But also just know the other nuances too, like I just shared. So thank you for that. Anything to add, Ms. Jules, about this question? I just wanted to add a little bit
to her. There is a massage for fun and there's a massage to check your breast. Just know what you're doing. If you're doing it for self-examination, know the proper way to massage. Like Doc said, go into your armpits, come into your chest, come into your, really know the steps, know what you're doing. And also remember, doing it often, you can feel lumps if you are, closer to getting your period, things like that. So be mindful. That's why I said to everybody, 1 week after your period, if you're a young girl and you're getting your cycle, at least giving yourself that week after your cycle allows all the lumps, all the, hormonal gorging that your breast has gone through, preparing it for your period. Now everything is settled and your breast is back to normal and you can properly check. Now, for pleasure, by all means, listen, like I said a few weeks ago, quite a bit of husbands have found their wives' lumps. So please, enjoy the process.
Love it. Thank you.
So just to piggyback on what Juice just said before I read Ella's question. So all this stuff that the Queen Mother was talking about, hey, Imrantie and I mama Imrantie nyenye se ma Imrantie nyenye se nyina is not true. Remember the video about the Queen Mother when she was saying that come the month of October, the women should avail themselves, and they, like basically it was a huge deal. Like in Ghana, they had a workshop going on. So all this is not true.
No, it is. There's value in it.
I think there is truth to it. I think that there's definitely truth. I think that the promotion.
So it's not just the massage. They also have the sucking part of it too.
Let me be honest with you. Let's maybe Doc can even explain that a little bit better. The sucking part is not true in the sense that you have to remember when a woman is breastfeeding, lactating and breastfeeding her baby, it's a fact known that when a woman is lactating, her chances of getting breast cancer is less. Well, the men heard this and said, hey, if the baby is drinking breast milk and the woman is not getting breast cancer, then Charlie, every morning, every night, I'm on it. No, that's not the point. The point is that when she's going through breastfeeding her baby, her chances of getting breast cancer the risk are a little lower than if she's not. And that's all that is. Again, it's for pleasure or enjoy. I'm not saying don't do it. I'm just saying it's for pleasure.
You nailed it 100%. I think that's the fact right there, right? So it's all about hormones. That's the thing. That's the beauty of this, right? You think about women going through your menstrual cycle, right? That is, if woman is going through their menstrual cycle, they're not having a baby, they're not pregnant, all of those different things. So there's hormones fluctuating back and forth. Now, after a woman conceives, of course, they're not going through their menstrual cycle. A lot of hormones kind of titrate a little bit. And then also when they have the baby, the way that the baby is able to push that breast milk out, a lot of these hormones come into that factor too, right? So going through that process is actually decreasing that up and downwards regulation of those hormones. That is why it's summarized to say, yes, when a woman is going through the breastfeeding phase, it's not about the baby, it's the breastfeeding phase, they have a lower chance of having breast cancer. A man is sucking on his woman's breast. You're not breastfeeding. So you're not necessarily anything out of it. So I think that's the part that we tend to miss.
Okay.
100%. I think the massaging, there's a ton of value in that. I will say, yes, if you want to do that, it might be a good way to help detect and find lumps. Excellent. But I think it's also important that we understand why some of these things may be said in certain ways. So thank you. Does that help?
Yes. Oh, it helps. What about Ella's question? I mean, I think it was a statement. It was a statement, not a question per se.
True. Oh, I think Ella is just supporting what we talked about in terms of massaging and kind of moving things around, right? Lymphatic drainage. She said, I once had breast milk stuck in ducts. There you go. And I have to go check it out. Very important to be aware. So that's what we talked about earlier. Ella, can I agree with you?
That's excellent.
Yep, making sure those massages are so important, not just for breast cancer, just in general. You can actually help with lymphatic drainage through those massaging too. So that's critical. I want to go back and talk about the side effects of these drugs, right? And Miss Jules made a perfect point. There's a lot that these women go through that you don't tend to see day in, day out. And to summarize, when we think about breast cancer, and again, I'm going to generalize. Right now, we're in the phase of treatment where some of these drugs are a little bit more targeted. But the cocktail that Ms. Jules referred to, some of these drugs are very, very aggressive in the sense that, again, all you're doing when, a lot of these chemos that are non-targeted to treat breast cancer is the goal is hit all fast-growing cells, right? Think about your hair, and you talk about the source in your mouth, right? That epithelial tissue in the mouth as well. So that chemo doesn't discriminate. That chemo is like, okay, I'm going to go to your breast tissue and knock off that breast cancer. While I'm at it, I'm going to go to your stomach too. And a lot of them have GI side effects. You could have hair loss. That's why hair loss is a big factor. And we know hair is very critical too, because those are fast-growing cells as well. The mouth, sometimes even on the skin, there's something called hand-foot syndrome. There's a ton of side effects that these women have. Some of them, actually, the side effects go away once they're done with the chemo. Some of them, even after they stop taking the chemo, those side effects stay. And
wow.
Some women that they have chronic neuropathy in terms of the hand, because maybe the chemo was so aggressive in such a way that they couldn't tolerate it. So there's a lot of different side effects. But again, these drugs are working. And for some women, like you shared that woman's story, the 20th time, some of these drugs might not be able to work anymore because that tumor probably finds a new way to metastasize or find a new way to build resistance. Now they got to get put on different therapies too. So I think that's critical. And last thing I'll say about side effects too is that science has built this in such a way for us where, for some of these women, you can put them on prophylactic treatment. So if you have someone, I'll make an example, that says, whenever I take my chemo, I get super nauseated or anything like that. Sometimes we can, you can give them anti-nausea medicine. That might help a little bit. Or sometimes Benadryl. That could help maybe some of the different side effects too. So there's different remedies, but I think that appreciation here is for all of us to remember, especially women going through pure chemo, that's non-targeting. Those side effects are very, very rigorous. And you see some people, like you said flu times 50. That's what you said. Just imagine that. We get flu and I feel like I'm a little baby. And I couldn't agree. I've heard this. I've never experienced it, but I've heard it. Some women don't feel like doing anything. And sometimes you see them and they still champion it out and like
going,
fighting through it like nothing is going on. And I'm like, what drug are you taking? And they list the medicines you're taking. I'm like, there's no way that you're taking these drugs and these, but they fight through it. But it just gives me an appreciation for what this takes. And again, this is why we talk about this. Of course, some women cannot control, they have the disease, they have to take these medicines. And some women don't actually even get these side effects because they don't have access to these treatments. And that's another big factor we're talking about too right now. And hopefully we can get to a point where access is more, it's a little bit better, and we can keep managing these side effects too. But that's so important too. I have hope for the future of treatments because I know there's a lot more targeted treatments now, but we still have a long way to go. So thank you for sharing that.
Doc, I'm just praying that the hope you have extends to Africa in the biggest way because we need it. We really do. There are too many younger women. We're losing too many women. And breast cancer is now the #1 killer across Africa. And Ghana being at the top of those countries. So definitely.
Thank you for sharing that. And I see Lucinda, hopefully I said your name right. Question says, what's the effect on the child when breastfed with cancerous breasts unknowingly? Now, that's $1 million question, right? So I think
you never want to do that.
Yep, that's $1 million question. I think the picture being painted here is, imagine a woman has breast cancer, they don't know it, and now they're breastfeeding their child, right? That can put the child at an increased risk as well. I get it. Our bodies always have their own unique ways of coming up, fighting different things too. But I think, again, this is not what you'd want to do. In an ideal world, making sure at least if a woman has breast cancer and they have a baby they're breastfeeding, I feel like those are probably one of the times that you could actually feel a lump too, because the babies too, they also wiggling too, right, and touching stuff. So maybe you could feel a lump that way. But I highly encourage. I say, hey, if for a woman who has breast cancer, sometimes what would happen is they don't breastfeed. Some of the women might choose to do bottle feeding or different ways of feeding the baby, not just so they don't put the baby at risk. So there's a ton of different things that could happen in that case too. Anything to add, Ms. Jules, about that question?
So I ran into a woman in Kumasi a few years ago who came to me, and one of her breasts had quadrupled in size. But she also had a 10-month-old baby on her lap, and she was breastfeeding from the other breast. The doctor stopped her immediately because she hadn't been tested properly to see if she had it in the other breast or not. So they didn't want to take a chance on, God forbid, because looking at her and seeing the size of the one breast that was affected, that was quite obvious that she was literally ready to open up. To see that, it was really disheartening. So I will say that any abnormality with your breast, anytime you notice anything, especially when you are going through the lactating process, you're breastfeeding a baby, please let your doctor see it immediately. If you see an orange skin-like look on the breast, you see the areole, the darker part is too dark, is too, any abnormality, please let that doctor look at it immediately and help you out with that, please.
I couldn't agree with you more. Thank you. And Lucinda, that's a great question. So thank you for sharing that. All right. I want to move on to kind of our final part of our conversation today. Ms. Jules, just trying to pull you a little bit more. And, you know, you've shared a lot. And like you said, the stories are so important. That's how we know and learn. But I want to ask you, you know, what advice do you have for the women who live in some of these areas where, like we talked about earlier, testing and these treatments are not as easily accessible, just like we shared earlier? What advice would you have?
A lot of the remote areas that, especially across our country in Africa and other African countries, is that find clinics with nurses who know how to self-examine properly. And if you can go there and be taught how to self-examine, it will give you a chance, because not everybody has access to Google, right? So at least if you are in a community where there's a clinic, there's a nurse, let her teach you how to self-examine and learn how to do it. Allow your fingers to generate a memory with your breast. That way, as often as you do check, your fingers will pick if there's any abnormality. And, you know, I cannot encourage everybody to stay healthy. You know, even though we're talking about breast cancer, your general health is important. So eating well, making sure that your diet consists of some vegetables, some protein, some carbs, and exercising. As simple as walking. Walking is a great exercise. We don't always have to get into the car and go everywhere. Make walking a habit and make it something that you do often, and allow your body to also rest and relax. Like Doc said, get a massage. Let your significant other use the beautiful Inkuto to give you a good massage, and do the same for them as well. So let's promote general health. And I'm praying we all grow old together and take better care of ourselves.
I love it. I think that, you know, access to health is always there, right? It's the type of health that's always the biggest question. So what do we have at our fingertips right now? And that's what you just alluded to, right? We make do of what we have, right? Mm-hmm. Whether it's something as simple as building relationships with these nurses and doctors in these local hospitals that you trust or that have experience, that they can actually help with self-examination if you don't. One thing that you all do with Pink for Africa, after I learned about your story, I really, really love is how you all target young women. I couldn't agree with you more, right? And I think we notice in our culture most of the time, we're not proactively teaching children about a lot of these different things, right? And sometimes a child or a daughter, they only learn about it when they go to boarding school. That's when they see other friends and they're like, okay, what is breast? What does this mean? I think you're targeting these women at a young age is so important. But if you never got the opportunity to learn, take advantage of your local resources. You talked about using your fingers as memory. Over time, your fingers are going to remember what feels right and what doesn't feel wrong too. And your partners are there. Our food resources are there. And for now, what we have, we just have to maximize that. It's rather unfortunate. There's a big disparity in terms of access in a lot of these communities. But that's our hope. That's why I keep saying our hope is drive a lot of these things. And I know you all are doing it. So thank you for sharing that. The last question we have for you today is, you know, looking back at your journey, and I say looking back, but I also want to acknowledge that you're still in the journey, right? What have you learned about breast cancer so far that you want other men and women? I underline that on purpose. Just women, not just women, and men to know and learn from as well.
You know, one of the things that I have truly learned is that life is a gift, and as a woman, our contribution in society is huge. We are your mothers, we are your sisters, we are your cousins, we are your aunties, we are your girlfriends, we are your side chicks, we are your wives. At the end of the day, we need to be alive to give birth, to continue the process of human life. So men need to really be a little bit more kinder to their wives going through this process. We don't expect you to feel everything. We know you will not. But even though women are diagnosed more than men, Oftentimes in our communities in Africa, I hear too many stories of the men running away and leaving the women behind, and leaving the women with the children, and women living in this fear of telling their husband exactly what is wrong with them for the fear of their man leaving. Majority of our communities, men are the providers. So if a man says he doesn't want you anymore, it affects your economical status. Huge. So women are losing lives on the sheer fear of telling their husbands, or even there are husbands who flat out would tell their wife, you cut off your breast, I don't want you. I'm going to leave you. So the women don't, and they end up dying. So I would say to all of our men, we need your support. To our women, please don't be afraid. There is a community that stands behind you. Like Doc said, chemo doesn't pick and choose. Cancer doesn't pick and choose. It affects a white woman. It affects a black woman. It affects a Christian. It affects a Muslim. It affects a Jewish. It affects a tall, small, ugly, fat, skinny. It affects everybody. So that is why I was not afraid to talk about my story, because I felt too many of us Ghanaians hide behind this disease, because we somehow still live in this stigmatization that it should not be me or it cannot be me. So it's okay. It's okay. And there is a community behind you. Please know that Pink for Africa is here. I am very accessible. My cell phone number is everywhere. If you go to Facebook, it's there. You go to IG, is there. All the social media platforms. My cell phone is one of the easiest to access. If you can get to me, I will help direct you as to how to process and how to go to the next step. So please don't be afraid. And honestly, love on yourself. Love on yourself. Be kind to yourselves. Both sides as human beings.
I love that. Thank you so much. And I just put the link to the website. Again, I really want people to, my first, and just go read about it. If it doesn't inspire you, if it doesn't inspire you, you have a long way to go. So please look at it. I just want to say thank you. You know, a lot of the things that you've shared, I think, especially us as men, sometimes we forget and we just need reminders, you know, and I know breast cancer is mostly for women, but it also includes everything else that all of us have to deal with too. So I couldn't agree with you. I just want to say thank you for this conversation.
And Doc, you have to remember, for me, I'm the only woman in my household. I have 3 sons and a husband. And what I saw my kids go through during the journey, during the process, when I lost all my hair, when I didn't look so beautiful, when I gained a lot of weight, when my body changed, all of those things, I think, is hard on men to see, because my children saw me as this strong woman, strong mother who doesn't crack for anything. And here I was being beat down with cancer. So I think that we need, as much as we have this tough exterior, we also need you to hang in there and stand behind us.
I love that.
Thank you so much, Doc. Thank you.
Thank you. No, thank you for sharing these stories.
PK, thank you guys. Thank you.
No, thank you so much for coming.
Allowing us to come up.
Thank you. Thank you so much.
And to talk about this. This is so dear and so important. Thank you.
Thank you. PK, we'll turn it over to you, but I just want to thank everybody for joining this conversation today. As jokingly as we said earlier, this is concluding Breast Cancer Awareness Month, but breast cancer doesn't stop, right? It's a lifelong journey. So please, whether it's educating others or just taking it up on yourself and at least learn about it or doing your self-examinations, these are very critical. So thank you all, and hope everybody has a great rest of their evening. So PK, over to you.
Thank you very much. We want to say a big thank you to Dr. Stephen Boateng, Anna Akatechie, Stephen Boateng, and also our very own sister, auntie, mother, friend. I like the way she give all the breakdowns. We are your wives, your side chicks, your girlfriends. Anytime you start, I start to laugh. I'm like, I don't know why you put all those adjectives to it, but hey, thank you so much for coming. We are very grateful. because breast cancer is something
Thank you.
that is worth talked about, and I feel like everybody should know about it. So thank you so much for coming, and I know out of your busy schedules you still make time to make this happen, especially Dr. Boateng. He had a whole event from like 1 p.m. to 5 p.m. today, and at 6 p.m. he like he has to jump on this. Man, I don't know how you do this. God bless you for your tenacity and also your astute knowledge and experience in the industry as you help people. I can't wait for you to be our soon celebrity doctor, making things happen, because these are topics like, sickle cell, cancer. Those are topics that people don't want to speak about in the entertainment space. And when people have people like you, it'll be great. So thank you for coming. So as we wrap up, I'm gonna make sure I open up for like another 5 minutes for questions. If people do have any questions for them to ask. And
PK, before you proceed, I would like to say, Jules, look, I know we found light in the conversations, right? Dr. Boateng, we found some comedy in it, but not only do we appreciate you guys coming, but it's an intimate part of your story that you decided to share with some random people, black squares, that don't even show their face on the call, right? It's a heavy task. So again, we truly appreciate that. It's easy for people to listen to a narrative of like, oh, breast cancer. It feels a bit distant. When somebody's talking to you intimately about it and openly about it, as you have, right? We're grateful. We're deeply grateful. And for Dr. Stephen, I apologize what happened to you this weekend, but it's okay. It happens. Okay. It's not you, it's us. But to be fair, Pokwara is a great school. I will say that it is a great school.
Appreciate it.
But Jules, thank you so much. Seriously.
Thank you.
And I still need the link, please. So if you got,
I sent it to you, David. I sent it to you.
Thank you. PK.
And I did send it to his personal number too.
Thank you, PK. I got it.
No
now.
problem.
Thank you.
No, I mean, sometimes I think that is an Achimota approach. What he just did right now, per seconds really don't do that. But anyways,
What school did you go to, PK? I keep forgetting.
as I was saying,
You don't have to share. It's okay.
as I was saying that I was rudely interrupted. All right. All right. Yeah. This is one reason why I was so bad when Presec won. Anyways, big ups to all the Presecers, all the Dardians, except one person for achieving this 8th trophy. I think so it's a milestone a lot of people want to see achieve. The next person after them is 6, which is Prempeh College. So this is gonna be a long race behind, and for them to win back to back. I think so we must give them the credit for that. And man, the difference was bad. Anyways, thank you guys so much for coming. So proud of you guys. I can't wait to see this unfold. But next year, Disco will be in the race. A lot of schools will be in the race. So I'm still getting interrupted by Director David. Ladies and gentlemen, we're about to switch over to Tap Tap Send, but please, if you have any questions, we have them for the next 4 minutes, so that they can answer any questions that you have. If you want to unmute your mic, when we went to Facebook, Kumasi Nyami said, good show, and also had another comment from, I think it was Mami, let me get the name right. Mami Sapon. It's a great program. I'm supposed to say great program. It's always educative, and it's crazy how when you break it down and people just absorbs all the questions because you just answered everything that they have. So if we don't have any more questions, I'm gonna give it like in a minute or so. We're just gonna run into it. I want to say big thanks to our sponsors for making this happen. A huge shout out to big thanks to our producers. Nana Lord, and also Danny and the A-Class, all the way from Europe, making sure that this is happening. So thank you guys all for making this happen. Thank you guys. At this point, we're gonna say big thank you. Director, I was gonna ask you to really come and give a sign-up message, but you already did. you cut through it, so we're just gonna take that as a sign-up message. And thanks, Miss Jules, for coming. You can stick around. Now we're about to get off Facebook, and we're gonna allude right into the Tap Tap Say Q&A sections. And if anybody has any questions, A class said, thanks a lot. We really appreciate your time. Yes. So A class is thanking you, Miss Jules, and Dr. Boatin as well for your time. And the same way with Director David as well, saying that thank you guys for coming as well. So please, Tatap Sen, if you have any questions or concerns as we leave, oh yeah, our Facebook and YouTubers, thank you all for coming. Thank you all for watching. And Kumasi Nyami, I know you always have a show whilst I'm also doing my show, but you always chime in to come on the show and just see what's going on as well. God bless you for being supportive, and everybody that is watching and listening. Those of you at work, Lucinda, I know you are at work, your practitioner, you're at work, and you're still taking the chance to come in and ask all your questions as well, including the Kia, your practitioner as well too, and you are doing your best to come in and ask all those questions. You guys are doing a great job. Keep doing what you're doing out there. Whilst Dr. Boatin is doing his on Zoom, you guys are doing yours on the field. God bless you all. And our Zoom, viewers, man, you guys are awesome. You guys are great. So let's go into the top 10 session.